Tumor sidedness remains something that people are still not entirely sure what to deal with, but I think overall most of the data is consistent that left-sided tumors simply do better than right-sided tumors. So prognostically, I think there's been enough, albeit retrospective, but very circumstantial and a huge body of evidence to suggest that indeed right-sided cancers do worse. No matter what they get, no matter how they get it, by and large, they're a worse behaving disease. With respect to what treatment should be given, that's much more controversial. The tendency to give EGFR inhibitors in left-sided patients has increased since the final results of CLGB-80405 and FIRE3 showed that that's really the group that gets the most benefit from EGFR inhibitors is the left-sided tumor. So there's no question it has increased. That doesn't mean it's the right thing to do for every patient. That has to be weighed in an individual context related to what the role of the treatment is. Is it palliative, or are you trying to get a patient to surgical resection at some point down the road? These are various things that go into it. So if we had a pool of patients with left-sided tumors that were RAS wild type, I think a far greater number amongst that pool would receive an EGFR inhibitor compared to what they would have 5 years ago before the sidedness data emerged. Generally speaking, we know that on a mutational level, left-sided tumors are different from right-sided tumors. On a clinical level, they present different clinically. And everybody thinks that right and left side is simply a surrogate for different biology, that we're talking about a very different, both phenotypic and genotypic tumor that arises from the right side versus the left side. I think that most of the data suggests that patients with right-sided tumors simply do better with VEGF inhibitors. And whether that's due to a more dependence on the VEGF pathway, as has been suggested in some papers, that simply those tumors have more activation or more overexpression of some of the VEGF ligands to make them more sensitive to VEGF inhibitors, or there's some other reason, is not yet completely understood. But the clinical data certainly supports the fact that the patients with the right-sided tumors do better with VEGF inhibitors.